Thank you, Acting Speaker. I'm happy to contribute to this debate, and I thank the Minister for Health for proposing the amendments for the Public Health and Wellbeing Amendment State of Emergency Extension Bill 2021. State of Emergency Bill is about keeping Victorians safe, and I thank the crossbenchers, Patton, Medic and Ratnam in the upper house for putting Victorians' welfare first. Victoria has the most transparent jurisdiction where we must come back to Parliament to extend the state of emergency. That is the democratic process, and the amendments arise out of that process. And in fact, in New South Wales, the Health Minister can enforce the state of emergency and is not required to put it through the New South Wales Parliament. Other state jurisdictions have a state of emergency or equivalent in place. The constituents in my electorate of Melton have clearly indicated to me that they just want to be able to be kept safe. The extension of the state of emergency is not their major concern. They just want COVID to go away. They want to be vaccinated. They want to be able to live their lives in some sort of normality. And they know we are getting there. The member for Caulfield said people cannot plan, and I believe this is an exaggeration. Well, my constituents are planning their lives and events. And in fact, on Saturday, I attended a Hindu festival in Melton. And then on Saturday night, I attended the Team Teal Trots Night for the ovarian cancer fundraiser. It was a great night. Not one person raised any concerns with me at that event. I've been involved over the last 5 weeks in a corporate bowls challenge in Bacchus Marsh, where local clubs, businesses and local identities come together and socialise over a game of lawn bowls. You know what? People were enjoying themselves and were very competitive. I met with paramedics recently at the Brighton ambulance station with the member for Bentley. Those paramedics expressed their thanks to the Andrews government in keeping them safe so they can keep Victorians safe by responding to people as required. I extend my thanks to nurses, doctors, health professionals, frontline workers, police, teachers, paramedics, and every worker and every business that has helped get us through this pandemic. While those opposite will attack contact tracers and public health officials, I want to thank the contact tracers and the public health officials for their tireless work during this pandemic over the last 12 months. Those opposite appear to oppose everything during this pandemic. I think they have made that decision to keep themselves relevant. Well, that hasn't worked either. I will go to the detail of the amendments so it is quite clear to everyone. The first amendment regarding the introduction of review mechanism for detention notices was raised in the Victorian Ombudsman's investigation into detention and treatment of public housing residents arising from a COVID-19 hard lockdown in July 2020. This House amendment seeks to give policy effect to the intent of the Ombudsman's recommendation, whilst also ensuring that the review mechanism is prompt and sufficiently targeted to meet the objective. This amendment inserts new provisions into the Public Health and Wellbeing Act 2008 to establish a detention review mechanism. The detention review mechanism will allow for a recipient of a detention notice to seek review of the detention decision by a detention review officer, who will be a person with legal qualifications who is appointed by the Secretary. The detention review officer will be responsible for reviewing the detention order and whether it is reasonably necessary to eliminate or reduce a serious risk to public health, and must give written notice of a decision with reasons within 24 hours of receiving the application. This amendment does not change or remove the current ability to seek a review of the detention notice through the Supreme Court. The second amendment is fines for young people. The second House amendment is to allow the variation of penalty amounts for fines related to breaches of the Chief Health Officer's directions to children. This amendment acknowledges the additional financial burden on children compared to most adults, and better aligns with maximum penalty that the Children's Court is permitted to impose under the Children, Youth and Families Act 2005. Each of these amendments are designed to further ensure that the use of the state of emergency powers is fair and balanced. It's important to note that the Chief Health Officer exercises emergency powers on the basis of proportionate, timely and expert evidence-based public health advice, with the intent to reduce the serious risk to public health caused by COVID-19 driving exercise of power. Each time the public health directions issued under the state of emergency, they are reviewed to ensure they comply with principles of the Public Health and Wellbeing Act 2008 and the Charter of Human Rights and Responsibilities Act. Victoria is the only jurisdiction that has a Charter of Human Rights and a monthly report to Parliament on the extension of the state of emergency. There are also a number of policy areas that the government will seek to address through strengthened communication materials, and this will include clarification in relation to obligations and process for organising mass gatherings, including protests, options available for vulnerable people when possibly issued with a fine, and review options and support to have your fine reviewed for all people when issued with a fine. I just wish to reiterate my comments when I spoke to this bill the first time. The extension to the state of emergency powers under the Public Health and Wellbeing Act 2008 is necessary to ensure that the Chief Health Officer can continue to use or have available emergency powers to respond to the ongoing global pandemic, including issuing directions that are reasonably necessary to protect public health, such as detention notices or requirements to wear masks. The emergency powers delegated to the Chief Health Officer under the State of Emergency Declaration are essential to enable measures that prevent the spread of coronavirus in the Victorian community and to manage and contain the spread of any outbreak. Without a further extension of the state of emergency, Victoria will be unable to maintain the current measures and restrictions in place that are essential to keep Victoria safe and open. And the state of emergency powers also allow the Chief Health Officer to act quickly in response to outbreaks in other states or territories to prevent the spread of the virus within Australia. Without the ability to extend the declaration of the state of emergency, the Chief Health Officer and the wider Victorian community are left powerless in defence of this virus, which would have broad implications for the Victorian economy as other states respond to our inability to put in place any restrictions. This may include directions for people who have tested positive to isolate and put the Victorian community's health at risk. This pandemic isn't over, and as we work hard to get the community vaccinated as quickly as we are able to, we need to have the powers available under the state of emergency to respond quickly, to keep it under control so we can continue to stay safe and stay open and enjoy things again, such as sports and events and festivals and outings. And that's important to all of us, and it's important to all of us not only from being sociable and things like that, but also for our mental health. The directions from our health officials, mask wearing, washing hands, contact tracing restrictions have all been effective when we have had to manage this crisis. No one wants them. However, the alternative is worse. Untimely deaths and families not able to say goodbye to loved ones is something that has been limited here in Victoria. I want to thank the Chief Health Officer and his team for their courage and strength in making difficult decisions. I acknowledge the contributions from this side of the House, in particular the member for Ivanhoe for his contribution. I also wish to acknowledge the member for Brunswick's contribution. I think it was really well done. I support these amendments to the bill and I'm happy to do so, so thank you.